we have four wonderful presenters who've been working really, really hard on, one important part of a multi-pronged approach to trying to address the mental health crisis that, we're experiencing here in Hawaii as people are, elsewhere also. And I'm really excited to have the opportunity to learn along with you. For our presenters, usually the way we do is I'll kind of monitor the chat so that if there's any questions in the moment, like a clarifying question or definition of a term or something that someone doesn't understand, then I might interrupt. Otherwise, we'll let you go, through your presentation and then, have time for questions and conversation at the end. So without further ado, I'm going to pass on to all four of you, and I'm really excited to have you guys here. Mental health is such an important topic. So thank you so much for being here to share your amazing work. Go ahead.
Yeah, so thank you everyone. So I'm Renzi. I'm with the Department of Health, and Eden and I we are both with the Department of Health on the Pediatric Mental Health Care Access Grant, and we're presenting alongside Karen from Queen's Health System, who is a part of the staffing for the teleconsultation line, and then Amma King is from JABSOM's Department of Psychiatry, and they are our external evaluators. And then I'm just here to kind of share just a brief overview of our services and where we started, and then we'll pass off to Karen and Alma. So next slide. We As mentioned, we don't have any disclosures or conflict of interest, but just to note that we are funded by a federal grant from the Health Resources and Services Administration of the U.S. Department of Health and Human Services. But our content is not necessarily representative of HRSA, HHS, or the U.S. government. And next slide. And then next slide. Um, so just a little background. So the Department of Health received the grant back in 2021, and its main focus was to support the integration of behavioral health into pediatric primary care. And it is mainly the overall goal is to help pediatric providers gain the knowledge, skill, and comfort needed to address mild to moderate mental health conditions within their clinics. And Hawaii PMHCA focuses on three main deliverables. So next slide. And the first is training, such as we have continuously worked with this pediatric echo to host series and other learning opportunities for pediatric providers to participate in, including REACH, the patient-centered mental health and pediatric training that we had completed back in July. And then the second and third focuses are central to the Hawaii PMHCA grant is establishing a teleconsultation line where pediatric providers can speak directly with a child psychiatrist. And the other is having access to also a care coordinator, such as a social worker who can assist with identifying resources and navigating referrals. The consult the consultation line is created as a mean to um, be a supportive resources to help providers as they see mental health cases in their clinic, and to be that added support that so aside from just the training, it works in conjunction so that we're not just sending you off to a training and expecting you to be able to do this all on your own, but to also have continuous support as you learn more about supporting behavioral health needs. And overall, we hope that this resource is addresses and helps with ongoing behavioral health workforce shortages. For next slide, please. Oh, sorry, and next slide. That's not did it. And then so this one is just a summary of kind of the needs and why we have a pediatric consultation line, and then kind of what we hope to help address. And then like the workforce shortages. And then for our partnership, so as I mentioned, this is a collaborative partnership within us at the Department of Health, the Queen's Health System, and as well as UH-JABSOM. And then next slide. So when we first had launched the program, we did start in August 2024 with a um, pilot for Maui County. And this was also in partnership with the Hawaii Community Foundation's Promising Minds initiatives. And the within the initial pilot, it had really helped us with moving forward to be able to expand statewide. And our Maui pilot, next slide, has actually helped us with moving forward. So our Maui pilot, we received actually some really good positive feedback and ideas of how better to expand in service. A lot of the providers that did use the Maui pilot found that the consultations were helpful and they appreciated the clear summaries from psychiatrists and felt supported in understanding behavioral health conditions. Many said that the program did help improve their confidence when helping with the behavioral health needs that they saw in their clinic, and they were hoping that it would continue on. And then Amma and Karen will share more about what we did previously as well as what we continue to do. So I'll hand it over.
Okay, hello everyone. My name is Amma, and just to touch a bit on the needs here, we are seeing an increase in the needs of pediatric behavioral health here in Hawaii. As Renzy mentioned, we do have a shortage of um, psychiatrists and how that's impacting the children of the state. So you can see here some of the most common behavioral mental health conditions faced by the children, such as anxiety, depression, ADHD. And some of these are more prominent than others, such as ADHD, anxiety, and depression. And so, what the MPAL program is doing is providing rapid access to specialists to help support the treatment of this by the PCPs that the children are seeing. Next slide, please, Ian. So we conduct a pre-survey prior to people registering for Hawaii-MPAL. And this is some preliminary information. It was a small sample size of 5 individuals. These were all pediatric PCPs. And just looking at this chart and looking at what the colors represent, you can see that we have quite a few categories where they are only minimally comfortable or have the knowledge and comfort level of providing care to children who face these conditions. So in the blue, only minimally, a lot of that there, and then some are only, each category, some of them are only somewhat comfortable and knowledgeable of the conditions and how to treat, diagnose, and manage them. So I think ideally we would like to see, less blue here, less purple, more of the orange and yellow to show. And so that is what, through various I guess, courses that they take through some trainings and also the MPAL program that they can get the support that they need in order to feel more comfortable and more knowledgeable addressing these concerns because there is a great need among children in the state. So, but just some of the common conditions that they screen, diagnose, and treat and manage: ADHD, depression, anxiety, autism spectrum disorder, suicide risk. And then we have a little at the bottom, you can see some more conditions such as bipolar, PDD, which is persistent depressive disorder, OCD, obsessive compulsive disorder, substance use disorder, psychosis, and then disruptive mood dysregulation disorders and aggression. So these are just the conditions that the pediatricians are addressing. Next slide. I think maybe, yeah, Karen.
Yeah, thank you, Amma and Renzi. So, hi everyone. I'm Karen. I'm a licensed clinical social worker with the Queen's Health Systems. Um, I'm here to introduce the Hawaii Mental Health Pediatric Access Line, short for HI-MPAL. So, HI-MPAL is a statewide program designed to support prescribing providers who are caring for children and youth from birth through age of 21. The service offers access to child and adolescent behavioral health specialists who can assist with diagnostic clarification, treatment planning, medication management, referral recommendations, and care coordination services. One key point to emphasize is that HI-MPAL is designed to support prescribing provider rather than replacing specialty mental health services. The goal is to equip PCP and other prescribing providers with timely expert consultation so they can make informed clinical decisions while patients remain connected to their medical group. Families don't contact the HI-MPAL service directly. Instead, provider can connect with one of our team members, and when appropriate, family can be linked with resources and services through referrals. Next slide. So this slide covers how to access the HI-MPAL service. We make it really convenient and simple to access the HI-MPAL line. Providers have two options. They can either call the access line directly at the phone number listed here, 808-691-MPAL, which is 6725, or they can submit an online inquiry form through the HI-MPAL website. Providers are encouraged to complete a one-time registration process. Registration can be completed either over the phone or through the website. Once registered, future consultation requests can be made quickly and efficiently. The service operates Monday to Friday from 8 to 4:30 Hawaii Standard Time, and that is excluding holidays. The next slide will cover how to access the HI-MPAL form. So this is a snapshot of the website. The website has both the registration form and the consultation intake form. We intentionally designed the process to be straightforward and very easy to navigate. The form should take no more than 5 minutes to complete. When speaking with provider, I encourage them to either bookmark the website and complete the registration form ahead of time before they need a consultation, or call the line and complete the registration with one of our warm line team member. If you complete the registration form ahead of time, it really helps streamline the process when an urgent clinical question arises. This website is also a central hub for programs information, resources, and contact details. And Renzy has put the website link in the chat for your reference. And this slide captured the two forms that you will be filling out in the website. The registration form on the left captures basic provider demographic information. Again, you only need to complete it once. The form on the right is the intake form, which is an inquiry form for you to fill out whenever you have a question, whether it is on a specific patient or just general clinical concern. All the information are kept confidential within the HI-MPAL team. Your patient's information is safe in this HIPAA-compliant platform. Again, information collected is really minimal, but it helps our team ensure that we are able to respond to your inquiry and allows the psychiatric consultant to review relevant clinical details before any discussion occurs. And Amma?
Yes, I'll speak a bit about our pre-survey. I mentioned earlier that we do a pre-survey, and you saw some results from the ones that we've done so far. But as part of the evaluation team with me and Dr. Jane Onoye, who's in our audience, we primarily conduct surveys and interviews to gain feedback from providers, just across mental health in the state. And so we have this pre-survey that pediatrician that PCPs can fill out, not just PCPs, but others as well in the mental health care field, can fill out before they register for MPAL, just to give us an idea of where people are, what the need is. And so it's just a brief 5-minute survey that assesses common pediatric mental health conditions, as mentioned earlier, and distributed to primary care providers at the time of registration. And some of the ones that that was reflected in the chart earlier are individuals who may not have registered, but we still like to get the feedback from the providers just to know where people are and what the needs are. This is an incentivized survey. We distribute it via different marketing events and virtually, and it can be accessed via the link or the QR code. And we really hope to get more responses. To support our evaluation processes, we need more data. So, this can be get a snapshot of this and complete the survey, pass it around, along to others, who may be able to complete this for us. But it's about 13 questions, and 11 of those questions are really trying to capture what it is, the information that we need. So we're asking things like, how knowledgeable and comfortable are you with diagnosing, treating, managing these common mental health conditions? What is your area of expertise? Are you a doctor, are you a nurse? What is your background? And where do you practice? We ask questions about the zip codes that you serve in the state. So those are some of the questions. And then at the end, it's anonymous survey, but if you want to get the incentive, which is coming through Renzy, then we will ask for your email address. But none of your information will be shared like publicly. We won't know who submitted which survey in terms of making the information public. So you don't have to worry about that. But there is an incentive to do that. And that is the information.
Great, thank you. And I saw the survey link is also posted in the chat. One thing to add is for provider, if you complete the registration form, once you submit the registration form, a link will be redirected to this survey as well. Okay, so a common question that we received is, what kind of cases are appropriate for HI-MPAL? The answer is almost any pediatric behavioral health question are appropriate. Provider can call with general clinical questions such as what screening tool to use, differentiating diagnosis, trying to understand treatment options, or determining what specialty referral is appropriate. They can also call regarding any patient-specific concern. One example will be you have a patient, you're not sure what to put for the diagnosis, you have question on medication initiation or titration, side effect monitoring, or simply, any treatment recommendations that you would want to get input from a psychiatrist. One thing to note that provider don't have to be in a crisis in order to call. It can be as simple as, I have a patient with depression. I wonder what medication I can start for this particular patient. And it doesn't have to be a highly complicated case in order to utilize our line. Sometimes just a brief phone call for consultation can provide reassurance, confirm treatment plan, or just help identify the next best step for your patient. Again, we highly encourage providers to think about what HI-MPAL is and how you may be able to utilize it as a clinical partner resource. Next slide will cover what happens after we received a consultation request. So first, a provider can either call or submit an online request form. A member of the HI-MPAL team will gather the necessary information and securely communicates the consultation request to one of our psychiatrists, as well as linking in one of the licensed clinical social worker on the team. The psychiatrist consultant will then make a phone call to the provider on the preferred time to discuss the case and provide recommendations verbally. After the consultation, the provider will receive a written summary of the recommendations through a secured communication channels. Right now, we are faxing back most of the referral unless it is specifically requested by the caller to send it through a HIPAA compliant platform. If needed, family supports if the referral needs additional family support or psychosocial concern are identified, one of our social worker will then provide additional follow-up and resource coordination. Again, that can be provided directly to the PCP or with your, if you have obtained patient's permission, our team can reach out to the patient directly with those resources. Again, we're trying to make this process as efficient, as easy as possible, and we welcome any feedback that you would provide if you utilize the service and have any suggestions or concern. Next slide. So again, the HI-MPAL service offer much more than just psychiatric consultation. For cases that acquire additional evaluation, patients may be able to get referred for a one-time psychiatric assessment through the Queen's Counseling Service, depending on clinical appropriateness and availability. For neighbor islands or providers that are not on Oahu, our licensed clinical social worker can also provide resources for community-based referrals. I don't know if we mentioned it earlier, but this grants support provider that are on in the state of Hawaii and the Pacific regions. So I'm not sure if there's anyone on the line that are from the Pacific Basin. We also are working on linking up with service navigation for those that are not in the state of Hawaii. For many providers, one of the biggest challenge is not diagnosing or treatment planning, and it is helping families successfully accessing service. So this HI-MPAL line hopefully will be able to help address the gap in support in supporting family in accessing the services. And then I have 3 case example to help showcase what might be some appropriate referral to the line. So this case, the first case is, we have a 10 years old presenting with inattention, declining school performance, excessive worry, and sleep difficulties. The symptoms could be related to either ADHD, anxiety, or both. Many providers face uncertainty when symptoms overlaps across diagnostic categories. So the provider might have question like, what is this child experiencing, and what approach should I consider? Through the HI-MPAL service, the provider can discuss clinical presentation with a child psychiatrist and receive guidance regarding diagnostic clarification, additional assessment strategy, medication consideration, and referral to treatment or evaluation recommendations. Psychiatrists have provided tools, for example, the Venable scale, and we emailed the caller a copy of the scale to be administered by the parents and the teachers. Again, through the consultation service, the provider is able to come up with more tool that they can utilize to secure the diagnosis and have the next plan in place in how to further triage the child into appropriate services. Again, the goal is not necessary to provide a definitive diagnosis during this consultation, but to help the provider develop a more clear and evidence-informed plan to move forward. Okay, that brings us to the next case. This example highlights a medication management question. So patient is a 15 years old with depression. He or she has already been taking SSRI for 8 weeks and has experienced only partial improvement. So now the provider called the consultation line with questions about is it time to increase the dosage? Should I continue with the same medication or try a different medication? Should we try to add psychotherapy or pursue specialty referral? Again, when the caller reach out to our line, our psychiatrist consultant is able to provide the provider with evaluating treatment response, review evidence-based medication strategy, and discuss, monitoring recommendations. And then together, they determine the appropriate next step in care. Again, it depends on the patient's insurance and geographic location. Some might be able to access direct psychiatry in a timely manner, but some could have a difficult time accessing or could have a longer wait time. So by having the consultation in place, many prescribing provider are now able to have a more, evidence-based treatment plan while waiting for patient to receive a higher level of care. This type of consultation can help provider feels more confidence in managing the behavioral health condition in their care while patients either wait for specialty service or continue treatment in primary care settings. Okay. And then let me cover the third case scenario on what services we provider have utilized our line for. So this case demonstrates how HI-MPAL can support provider in managing more complex clinical situations. Here we have a 17 years old who is suspected of having a first episode of psychotic disorder. And the provider has already made referral to community psychiatry, but there is a wait time before the evaluation can happen. So the PCP called into the line, talked to our psychiatrist about diagnostic workup and how to address safety concern, how PCP can continue to monitor the behavioral health condition and assess the needs, as well as whether treatment should begin before specialty care becomes available. In that case, the provider wonders if we should try medication while waiting for the condition to be evaluated. So in this case, our psychiatrist provide some guidance regarding, diagnostic clarification. I think for this situation, there is a lot of comorbid or condition that we have to consider. So even though the child presents with a psychotic episode, we're trying to rule out if there's any substance use that could trigger the condition. Could it be like like a comorbid with maybe like depression or anxiety, OCD type of condition, alongside with the psychotic episode. And then our psychiatrist also provides some recommendation for medical workup, like lab monitoring, lab work that can be done ahead of time. And they also discuss medication options as well as safety planning. So this case consultation showcase how the program support provider who feels, kind of like helpless and alone, isolated in this situation when they're stuck with a long wait time before a child can be seen. I mean, the other option that the provider have is maybe sending the child through the emergency room. But then there are some hesitancy in like, is it appropriate use of the emergency room service? And how would the family and the child be affected with, like an acute situation? So this supports really helps provider feel less isolated when managing a high acuity cases and help patient receive timely care within the PCP's clinic while waiting to be referred out. Okay, so the next slide will cover some key takeaways. So as we conclude, I would like to highlight several key takeaways. Again, the HI-MPAL service is available for children and youth aged between 0 to 21 and can be accessed by prescribing providers throughout the state of Hawaii and the Pacific regions. The service is completely free to providers, and it offers rapid access to child and adolescent psychiatry service. Provider can also receive psychiatric consultation, medication support, diagnostic guidance, and referral recommendations, as long as some care coordinations assistant. Program is designed to strengthen the capacity of PCP and to improve access to behavioral health care for children and family. If you remember one thing from today's presentation, I hope that it is providers don't have to navigate the behavioral health challenges alone. HI-MPAL is here to support you and be a partner with you in navigating and managing your patient's behavioral health care needs. Okay.
And this is just a provider resource that was made by the national group for the child psychiatry access programs, as well as in partnership with the national AAP. And it is guidance on billing and coding tips if you do utilize the teleconsultation line, and how you can bill and code if you have access to the resource.
Renzi, do you have a link to that document? I think it might be useful for some of our participants to like open it up and save it to their devices.
Yes, let me pull it
Thank
up. I
you.
think. Yeah, I'll pull up that link, but we can move forward.
Okay, and
And
while
I
she's
believe that information is also available in our website.
Thank you. That makes sense. Of course it would be.
It temporarily, there was like a glitch with it, so it temporarily like is
Not yet.
gone, but
Oh
it'll be
no.
back. There was just the way it was uploading, so it
Hope.
had to be removed, but it will be there. But I'll send the link because that is it is available online through.
Thank you, Renzi. Because also then our team on the Echo end, when we post the resources, we can actually put a direct link so that people don't have to like save it from the chat, but if they want to go back later
Mhm.
and or if people are watching this asynchronously, then they can click on the link and access that. Because I'm an employed physician, so maybe that's why, although we have a lot of conversations about billing, but it would have actually never occurred to me that I could bill for that.
Mhm.
So probably the PCPs are savvier than I am, but
okay, well, I'll go ahead and touch on this last piece here. We've also put together a provider Pediatric Mental Health Provider Directory. And this is a statewide resource that gives up-to-date info on pediatric mental health care providers across the state on the islands of Oahu, Hawaii Island, Hawaii, and Maui. We also have one on Molokai, one or two on Molokai now. And it includes criteria such as the provider's name, location, contact, telehealth availability, and insurance that's accepted. So this is a really good resource, specifically for primary care providers and other healthcare workers, that can be accessed when you're trying to connect, children and families with mental health care support or make referrals. It's not, we try to make it comprehensive and include as much as we can. I'm basically just pulling this information from various resources um, and compiling it into a directory. But if you access this resource via the links here or the QR code and you would like to be added to it, or you see somebody that's there that's not there who you think should, you can email us the info via the email address that's on the directory. And we also have, oh, and let me also state that on Oahu, we have it set up that on Oahu, it's by region. So, we may have Leeward Coast, Windward Side, Central, Metro, Oahu, various categories, since this island has many different, areas of mental health care providers. And we also have a survey connected to this directory as well, because as I mentioned, we gather our information primarily from surveys and interviews that we do with providers. So at the bottom is a link to the survey that we would hope people who access the directory would complete for us so that we can get information on how useful they find it to be or where improvements might need to be done. And this is being updated every few months, so it's not just a stagnant list of providers. We try to keep it up to date so that it's accurate information.
And yes, the link back to our website. And that is it. If we have any questions.
Thank you guys. That was amazing. Morgan, did you want to say something?
Oh, I was just going to ask if I should launch the post-session quiz.
Sure, that sounds good. While people are thinking of their questions, we can do the quiz. Thank you. I think folks can ignore question 4. It looks like a typo. We'll give it about another 30 seconds or so, and then we can wrap it up. And I don't know how much we really need to go over questions, because actually people are getting it almost all right.
Okay, I'll go ahead and close it up.
Okay, so maybe just to emphasize for question 5, actually everybody got 100% on all the other questions. And several people answered the question that had no question or answer. So
Sorry about
you guys are
that.
amazing. You got that one all right too. But for question 5, our team had talked about how you can reach the service either by filling out a form or by calling. So just a quick reminder that you have access to it both ways. So you don't have to necessarily call, especially I would imagine, right? Like if it's late at night and you're done with, they're closed, right? And you're done, you're charting and you're thinking, oh gosh, I really need some help with this. That's a perfect opportunity to use the online form. And then hopefully you can get a call back then pretty quick, I guess, sounds like the next day.
Yeah, thank you. And I want to add, we have provider that asked their office staff to help make the call and submit the inquiry form, and it's totally fine as long as the staff has your availability for our psychiatrist to call you back. Our psychiatrists do prefer to talk to the provider directly instead of talking to the office staff. They don't mind calling the office at the designated time to get connected though. Yeah,
Thank you.
so
That's
just
really
want to
good.
clarify that. Thank you.
Yeah. This is an amazing service. I kind of remember the original PMHCA grant and the little small project and the pilot project on Maui. And Renzi, I mean, you are just a force to be reckoned with. You've been there from the beginning. So kudos to all of you for such really, really amazing work trying to, help our kids navigate just such a hard time to be living and trying to deal with such lack of services. Um, I don't see any questions in the chat yet, although I have one or maybe two. And folks, if you have questions, please feel free to drop them in the chat or unmute yourselves and share those too. But I'm wondering about funding and sustainability because as far as I recall, the PMHCA was a 5-year grant. We know that the feds have been cutting all sorts of very useful monies. Where are we at with sustainability for such a great program?
Yeah, so we actually were told that we can we because we did have a late start. I know that this was mentioned like long time ago, but we had been given the funds in 2021 and we did have delays as in launching. So then we did have funds that we are told that we can extend beyond for at least through each like 12-month periods. And then we also just applied for a next 5-year grant period. And that we're also waiting for just to get the responses on that, as well as we're hoping to use the next couple years of really of seeing how this program is working and refining it, and then doing that so then we could make a state legislative ask or put it within the Department of Health budget to support.
I was wondering if you were going there. So, another hat that I wear, Renzi, is that I chair the Hawaii AAP advocacy committee. So, if it comes to needing to make a legislative ask, please know that we'll be 100% behind you, and you just reach out and we can coordinate on trying to get support and stuff like that. Because I think this is, as me, I'm a hospitalist and I take care of the kids that fall through the cracks, the ones that swallow a whole bottle of Tylenol and half a bottle of Benadryl. And it's so heartbreaking when, they're on our service and they haven't been able to access the resources that they needed. So I'm just really grateful to see this. My other question was about resources throughout the Pacific Basin. You mentioned that you're available to everyone throughout the Pacific. How much utilization are you getting from outside of Hawaii?
So right now, we haven't fully launched because there is some with the Pacific, because there is some things we still need to figure out in terms of like how we are connecting like from our providers to theirs, because they actually have their like local care coordination within. So we're still refining those details, and that's kind of what we're in the process of working through right now. They From the providers in the Pacific, we did have um some of them be active in our trainings,
Mhm.
as well as they are actually going to meet with us in the next month to have our whole region meeting with the HI-MPAL staff. So right now we haven't received, like, we're not at the space for them to call directly yet, but that's what we're working towards, and hopefully do that within the next couple months.
Oh, that's good to know. Okay, thank you. Um, any other questions or comments, folks? Or any of our speakers want to add anything? Thank you, Amma and Eden, for putting that stuff in the chat. That was really helpful. All right. Well, I think we can wrap it up a little bit early, give everyone 10 minutes of their day back, say thank you to our wonderful speakers, not just for sharing with us, but really for providing such an incredibly important service to our keiki. I just, like I said, I'm so moved to see that this has kind of come to fruition and that it's really happening and helping providers to take better care of our kids. And yeah, it really is just very meaningful. So thank you all for your hard work.
Yes,
And
thank you so much.
yeah, and 2 weeks from now, we'll be talking about anaphylaxis and food allergies with Jennifer Mbuthia, who's one of our multiple return speakers, because I think we've all really enjoyed learning from her as well. So hope to see you in a couple weeks.